Hi friends, I'm Brittany Erickson and I lead FloodGate Medical's commercial, clinical, and executive talent acquisition within the urology space. I couldn't be more excited to share my takeaways from this year's American Neurological Association conference from this past weekend. This year, AUA 2024 was held in San Antonio, Texas. It's the home of the Alamo, the Riverwalk, the Spurs, and my favorite, Tex-Mex. Needless to say, I enjoyed my fair share of tacos, queso, and margaritas. Estaba tan delicioso. This was my fourth time attending AUA, where urology meets innovation. The annual meeting is in its 119th year and the largest gathering of urologists in the world. This event provides unparalleled access to groundbreaking research, new guidelines, and the latest advances in urologic medicine. The list of exhibitors included some established market leaders such as Olympus, Coloplast, BK Medical, Labrie, Karl Storz, and Boston Scientific. I'm looking forward to sharing some of my favorite new innovations with you. So let's go. This year I found there were three major focuses: simple, informative screening options, minimally invasive treatments and procedures, and unique solutions for incontinence and kidney stones. All with the end result being a vast improvement of quality of life for the patient. According to the American Cancer Society, 1 in 8 men will be diagnosed with prostate cancer within their lifetime, and the likelihood increases dramatically as they age. I was fortunate enough to have had the opportunity to speak with one of these brave patients who was at the show to share his story and to learn more about the many treatment options. Chances are, most of us know someone who has been diagnosed with prostate cancer, which is why I am so passionate about these amazing innovations and the impact that they have on patients' lives. First up, diagnostic testing options. Bio-Techne's exosome diagnostics has remained at the forefront of the field by developing the world's first liquid biopsy testing using exosomes. The ExoDx prostate test is a standalone exosome-based prostate cancer test, delivering a unique data point to help guide the prostate biopsy decision. It is a simple urine test that leverages the power of exosomes to detect disease earlier in the progression of prostate cancer. Considering the current increasing rate of prostate cancer in men, this is going to continue to be a much-needed tool for patients making life-altering decisions that will ideally improve and lengthen their life. Another tool that I learned more about at this year's meeting is MDX Health. They provide actionable molecular diagnostic information to personalize the diagnosis and treatment of prostate cancer and other urologic diseases. Their testing is based on proprietary genetic, epigenetic, and other complex molecular technologies. Their Select MDX test is a simple urine biomarker test that has an accuracy of 98% for detecting significant prostate cancers, which outperform other urine markers such as PCA3. This helps physicians determine if a patient is at higher or lower risk for prostate cancer, which means they can safely avoid biopsy. I mean, how awesome is that? Next, I'd like to show some love to innovative treatments and procedures. A few years ago, I learned about a minimally invasive treatment option for BPH called the TULSA-PRO from Profound Medical. Their transurethral ultrasound ablation technology is safe, precise, and durable. It's also flexible to treat many disease states, whether you are treating focal or customizable whole gland. The TULSA-PRO keeps the treatment in the MRI suite versus the operating room and leads to predictable outcomes, a minimized risk of side effects, and comprehensive applications. Patients love that it's an outpatient procedure that preserves their natural functioning abilities. Office-based and men are able to function normally. I call this a win-win situation. Promaxo has been seeing a huge demand over this past year, and it was so exciting to meet with their commercial team in San Antonio. They sure do know how to throw a party. Their proprietary technologies are protected by 250 patents and have developed the first MRI and robotic guidance system for in-office use. Their system can be integrated with several image-guided interventions, allowing the use of live MRI for a large number of procedures. This technology can help reduce scheduling time, reduce operating costs, and give patients a superior experience. No wonder they have won multiple awards and continue to see swift adoption nationwide. So how about an update on Signat Medical? They have a truly remarkable way of performing vasectomies. Their sealed vasectomy procedure, or SVP, is taking vasectomy to a whole new level of comfort, safety, and speed. This is the first innovation in vasectomy within the last 40 years. Their novel all-outside technique can be performed in under 2 minutes, making the procedure simple and reproducible while reducing potential side effects and complications. Plus, the best part is that it allows patients to get back to work and activity sooner. No more frozen peas, guys. Signat was founded in 2018, and I am excited to watch this procedure become a true market disruptor later this year. A nationwide study published in the Journal of Urology indicated that an estimated 5 million plus Americans passed kidney stone in 2022, a number that continues with an upward trajectory. The risk of kidney stones is 11% in men and 9% in women. For determining treatment, visualization of the stones is crucial, and this is where Pucin USA comes in. Pucin USA pioneered the first single-use uteroscope. It is the #1 used worldwide and used in over 90 countries. Their scope is the smallest on the market and is optimized for excellent image quality, ergonomics, and cost effectiveness. They have recently expanded their sales force in the US, so watch out because they are focused on market domination. Kixo is improving care for patients with kidney stones by delivering next-generation treatment solutions. They have developed the innovative CVAC aspiration system that utilizes irrigation and aspiration to remove kidney stones with the goal of surgically stone-free outcome, which is a challenge that has always been difficult to achieve consistently. Can you imagine a world where patients who suffer from kidney stones don't have to anymore? Kixo can, and they have the solution for it. Last but not least, let's talk about incontinence. Who doesn't love talking about incontinence? Of the 25 million adult Americans suffering from some form of urinary incontinence, 75 to 80% of those are women. Urinary incontinence affects 200 million people worldwide, and 1 in 4 women over the age of 18 experience episodes of leaking urine involuntarily. I would love to share some solutions with you. Lena Medical is changing the lives of women around the world. They're a Danish company that is expanding their footprint in the United States and launching 3 new products this year. This includes acquiring Eurocure's ARC2 transorberator sling system. They incorporate Eurocure's best-in-class laser cut sling with integrating stabilizing sutures. This patented innovation helps their sling maintain shape during the procedure. Sling surgery is the most common surgery doctors use to treat stress urinary incontinence, and Lena is performing it with excellence. Valencia Technologies is a neuromodulation company transforming the standard of care for bladder dysfunction. Ecoin is a tibial implant for urge urinary incontinence. UUI is the most common type of bladder control problem in younger and middle-aged women. It also may begin later, around the time of menopause. The coin-sized neurostimulator is placed under the skin near the ankle during a consistent, minimally invasive procedure using only local anesthetic. Bluewind Medical has a transformative long-term treatment option for UUI as well, called Frevi. Their implantable neuromodulation technology is a miniature device that is implanted near the ankle and sends signals up through the nerves to the bladder to help manage symptoms. It's a single outpatient procedure that uses local anesthetic and provides real results. After 1 year, 82% of patients saw a 50% reduction of urgent bladder leaks. Bringing drug-free relief to those patients is truly life-changing. I wish I had the time to highlight all of the exhibitors at this year's expo. It was action-packed to say the least. Thank you so much to those of you who took the time to educate me about your transformational solutions. Every year, I continue to be so impressed with these technological advances within urology. Please feel free to drop a comment below, share your support, or let us know which companies you found interesting at this year's AUA. See you next year in Las Vegas. Cha-ching!